Hi, my name is Sarah Knowles, and I'm an occupational therapist, and we are part of the OSF Healthcare Driving Program. Jenny Ream and myself do the driving evaluations here at this clinic. We are both certified driving rehabilitation specialists, and we are also certified driving instructors with the state of Illinois. We assess an individual's physical, visual, and/or cognitive functioning in regards to driving. During our session with our students, we will complete a comprehensive clinical evaluation. If the student has a permit, we will also complete a behind-the-wheel assessment to determine if the student is appropriate to complete behind-the-wheel training at school or through our facility, and/or if they will require additional hours of behind-the-wheel training or even adaptive equipment needs for driving. You might be asking yourself, who can benefit from this program? So if you have any students with physical disabilities, it could be spina bifida, cerebral palsy, muscular dystrophy, depending on their level. It could be students with cognitive disabilities, students that have poor attention to task, ADHD, ADD, students with visual processing deficits. So if they're having poor scanning, this will affect their ability to drive. What warrants a driving evaluation at our facility? If a student has some sensory issues, such as vision impairments, hearing changes, any decrease in sensation in their extremities, if they're having difficulties with walking, getting in and out of chairs, this could impact their ability for appropriate reaction times. If they have poor attention, poor insight, poor memory, changes in language or expression and comprehension abilities. If they have a medical history, such as limited range of motion or pain, this can also be distracting or impact their ability to drive. If they're having troubles with falling, inability to recognize unsafe situations, they may need to complete an evaluation prior to driving. Medications can also be a factor because some medications can cause drowsiness, confusion, dizziness, nausea. These all affect their ability to concentrate when driving. Here are some common diagnoses that may warrant an evaluation, but it's not limited to this list for sure. So the first would be a stroke. This could be something that occurs at birth or at a young age as a student. It could affect their vision, it could affect their physical abilities, their memory and cognition. Muscular dystrophy is another, amputations, vision changes, traumatic brain injury, spina bifida. With seizures, they have to be seizure-free for 6 months prior to returning to driving. Individuals on the autism spectrum, these may require some additional hours of training because they are very concrete thinkers. They may get a little upset if someone's not following the rules of the road. We work a lot on visual scanning, making those quick, decisive decisions when making turns. So they may require some additional behind-the-wheel training with an instructor. If someone has peripheral neuropathy, so lack of sensation in their feet, that may impact their ability to feel the pedals, and they may require additional adaptive equipment. Those with ADHD and ADD, any psychiatric diagnoses that may impact driving, spinal cord injuries, and cerebral palsy. Here is a list of medications that may impact driving. I'll let you go ahead and read through those, but a lot of those, the big factor that might come into play would be dizziness or drowsiness. So if they are on anything that makes them drowsy, they should not take that prior to going to drive. Another thing about medication If there is a medication that is used for ADHD or ADD, and it directly correlates to their ability to drive, so if it increases their concentration and they take a medication holiday over the summer break or winter break on a usual basis, we would not recommend that they take that medication holiday over the summer if they plan to be driving during that time. If they plan to take off of driving, then they are more than welcome to have that medication holiday. But if it helps them attend to the task, we don't want them driving without that medication. So you may be thinking, what do you do during your driving evaluations? So what we do is we complete a comprehensive medical and driving history. So for the medical, we look at what is their diagnosis, what are the medications that they take. We also ask about like home environment, what do they typically do for chores, how mature are they, do they participate in any responsibilities, do they need reminders to complete those responsibilities, or do they perform them on their own during that time. We also look at how dependent are they on their parents to answer the questions during our clinical medical history, because we want them to be able to answer their own questions, because if they were driving independently and they got pulled over, they would have to answer to that police officer who pulled them over. We also look at driving history. So do they have their permit? Have they been completing any driving hours with their parents? Any difficulties during that time? So those are some things that we would ask at the beginning of our evaluation. We also look at their physical functioning. So we look at their range of motion and strength and coordination within their uppers and lower extremities to make sure that they have the motion and strength to turn the wheel or press on the pedals, getting in and out of the actual vehicle. We look at endurance and sensation as well. We also check their vision. Illinois has various, they have requirements for vision. So we want 20/40 or better for day and nighttime driving, or better than 20/70 if they're only doing daytime driving. We also look at depth perception, so seeing what's close and what's far. That's important with driving because you need to know how fast a vehicle is approaching, how much time do you have to pull out in front of that vehicle, how much space do you have between you and the other vehicle in front of you. We also look at contrast sensitivity, so seeing what's light on light, dark on dark, to determine would they be appropriate to drive at night. We look at peripheral vision. Illinois also has a standard for peripheral vision that we have to meet. We also look at visual tracking, accommodation. This next thing we look at is cognition. So we look at attention, we look at their judgment, their memory, their visual spatial relations, their visual perception. We look at their problem solving skills as well. After completing all the clinical portion at the table, we will take them to a simulator where we just currently look at basic reaction time. So something would come up, it would either say accelerate or brake, and they have to hit the correct pedal, and we have to have an average of under 1.0 seconds to complete that for good reaction times for safe driving. We also look at their ability to main focus on the task. So if there's outside distractions, how well can they focus on that task at hand? We also look at their ability to follow multi-step directions and divide their attention to the task at hand. We also look at an assessment for adaptive equipment needs to determine, do they need the adaptive equipment, or would they be safe using the OEM pedals and steering wheel as well. If they have any adaptive equipment needs, they will need additional driving training to be completed. We typically prefer that to be completed at our facility, although some schools have decided to adapt their vehicles, and their trainers are very competent and comfortable with training on that equipment. If for some reason they don't feel comfortable with that equipment, it is recommended that they return to our facility for that behind the wheel training. For the behind the wheel portion of our evaluation, if they have a permit, we may have them kind of look at their visual scanning, their attention to task, how quickly do they pick up with the turning. And then at the end of our assessment, we do give recommendations on if they should go for driver's ed, should continue training, should they come for training with us. We'll go over some various recommendations that we may encounter later on in this presentation. With the OSF adaptive vehicle, we can evaluate and train for low-tech adaptive equipment. So some of that equipment would be the hand controls. So we have three different hand controls on the left side, and we have one on the right. So we have a push rock. So you rock it back for the acceleration, push forward for the brake. We have a push pull. For this one, we pull towards us for the acceleration, push forward for the brake. This is good because you cannot put the accelerator and the brake on at the same time with the push pull, and you can with the other two. And then the push right angle, you push down for the acceleration and up and forward for the brake. We also have the push rock on the right side if they prefer, if their right hand does better with the acceleration and brake. We use Sure Grip electronic hand controls, and later on you'll be seeing some pictures of that, and I can explain those further. We also have center console mounted hand controls. We don't typically use these as much just because they are more expensive, and it's mainly used for convenience and looks to help, like if they have a very expensive vehicle, someone might opt to have that so they don't have that bar going to the brake. We also train and have the equipment for left foot accelerators. A lot of times we would use these for the individuals with cerebral palsy, with right side affected. So if the right leg and the right arm were affected by the cerebral palsy, we would go with the left foot accelerator and a spinner knob on the left side. Again, we have spinner knobs. We will also go over, I'll have a couple different ones pictured that you can see later on in the presentation. We have adaptive mirrors. If someone has limited range of motion or limited peripheral vision, we would work on adaptive mirrors as well. And then we also look at secondary control. So how well can they access their wipers, or how well can they access their left turn signal or right turn signal. So we do have a crossover turn signal if they have no use of their left hand. It would just, we'll have a picture of that as well. There's a bracket that holds it on and it crosses over to the right side. There are electronic controls via the spinner knob, which we'll see later, or the Sure switch, which will actually go right onto the hand control. For our program, you must be able to transfer into our vehicle, and you need to be planning on driving from the OEM seat. We do not have a wheelchair accessible van, so if they plan to drive from their power wheelchair, we typically would refer them on to another clinic because it is best if they practice from their wheelchair, just because electronic or power wheelchairs, they have shocks and that may affect their stability with turns and acceleration and braking. So this is our crossover turn signal. It's kind of hard to see. I'll use my pointer to kind of show you the picture on the left. You can see the bracket that's holding it on here. It follows it up and it goes across. Then if you go over to the second, you can kind of see the side view. So you can see it goes behind that steering wheel. And then the third picture, you can see where you can access that signal. So you can push up or down and it will activate the OEM signal. The next one is our all view mirror. So this is utilized if they're having difficulties with rotation of the neck or peripheral vision. As you can see, we have our rear view mirror, and then they also have theirs. And then you can see that this is extra long. So this attaches over the rear view mirror, and you can see from the B pillar back on both sides. So that helps see in your blind spots. One thing to notice on this one, this is the all view mirror. I prefer this mirror over some of the other mirrors just because if it's more convex, it's very difficult because it becomes very distorted in your vision. This already provides a lot of sensory input, and then you add the convexity of the other mirrors, and it makes it very distorted and very difficult to concentrate on what's behind you. The next one is our hand control. So as you can see, there is a handle here on the left side of the steering wheel. What this is the push right angle. So you would push down for the acceleration and push forward for the brake. As you can see, there is a bar that goes to the brake. So this makes it more manual for that part. So if you were to push your foot on the brake, it will stop. If you put your foot under the brake, it will not stop. So if they have any extensor tone or unable to feel, you may need to put a pedal block just so they don't accidentally hit that. You can also see that there's a wire connected here that makes it electronic. So once we activate the hand control, if you put your foot on the gas, it will not work. So the only way to accelerate would be to push down on this hand control. You can see this little silver button. It's typically blinking blue when you first turn on the vehicle. You have to push it to activate the hand controls. If you don't activate the hand controls do not work, and you can just use the pedals. That's good if you're going to take it in for a service so someone does not run it into a wall. This is our left foot accelerator. As you can see, it's connected to a bracket on the floor. There is a pedal guard that blocks the actual accelerator. And then the accelerator now is on the left side of the brake. So you would push down here. What happens is there's a roller that would push down on the accelerator and then pull back when you let off the accelerator. So that's how that one works. There are quick releases, and there are also electronic left foot accelerators if they choose that type. These are two of our spinner knobs. If someone has difficulty with gripping, we do have some adaptive spinner knobs available that we can work with the students on. This is our standard one on the right-hand side. Nothing fancy, it just clips right into the clamshell there. And then it has a quick release, so you can take it off if you have additional students using that vehicle. Then this is on the left-hand side. This is one of the spinner knobs that have secondary control access programmed into it. So you can do the left signal, the right signal, you can add a horn, you can add wipers, you can add lights, whatever you want to program in there, you can put it wherever you want. So these have 6 different controls that you can program on that one hand control, and it is electronic. So now that you kind of know about our program, you're probably wondering, how do I get a student into your program? So for the physicians, sometimes they want them to come for an evaluation. They would need to send an order for an OT evaluation for driving and then give a specific diagnosis to warrant the evaluation. For the schools, sometimes the schools will choose to send their students to complete a driving evaluation if there's a physical or cognitive concern. Also, it is up to the school to decide if they send the student before or after obtaining their permit. How to make a referral. So if the student will need to get wants to come for an evaluation, they need to get an order from their physician. If they get it from outside of OSF, they can fax it to that 309-621-4148 number. After we receive the referral, the family will schedule the evaluation. Typically, they do it on their own time. A lot of people come during summer or winter break. They also may take off from school to complete this evaluation if it need be by the parent's schedule. If the school plans to pay for the evaluation, a letter of intent to pay should be faxed to our facility, and the number is given here in the presentation. Once the evaluation is completed, we do send a report to the physician and to the school if the school is paying for it with the recommendations. If the school plans to send the student back to us for the additional training, a new letter of intent to pay should be sent for the 8 hours of behind the wheel training that needs to be completed. So we do complete 8 hours rather than the 6 because we do not have observation at our facility. And at times it may be recommended that the student actually complete more hours of training than the 8 hours, depending on their needs. So a question a lot of people ask, does a student need a license or permit to come be evaluated? No, they can be evaluated in our clinic only. They may be able to be required to return with a permit in the future for behind the wheel based on different circumstances. Schools sometimes will send their students to prior to receiving their permit to determine if they should even enroll in the driver's education class. The cost, our evaluation is $350. It is not covered by insurance. It is a self-pay. If they need a reassessment within 1 year, the cost is $200 rather than the $350. If they require additional training, it is $100 per hour for behind the wheel training. So sometimes the school will pay for the evaluation and or training. If the school provides that service for the other students, they will typically pay for this student with disabilities. Work comp, but typically students are not working at this time and it's not a work comp case. And voc rehab, if they were working, sometimes they will cover the cost of our evaluation. What if the student fails our test? So when they complete the test, our results are sent to the physician, not the DMV. If there's potential for improvement, they may return for a reevaluation within 1 year of the evaluation. They may be referred to participate in PT, OT, or speech, depending on their deficits. Or they may even be recommended to return in a couple of years after maturing or developing further if they have potential to improve for driving skills. If we feel like they probably just are not going to be a candidate for driving in the future, we would recommend that they just not drive at that point. So what are some possible recommendations? So we may recommend that they be enrolled in driver's education and then complete the behind the wheel at school or return to our facility for the training. Again, we talked about completing the evaluation at our facility. The student will need to complete 8 hours rather than the 6 for behind the wheel training due to not having any observation time in the vehicle. They may recommend the student to have one-on-one training either at our facility or even at the school, and that would be so they don't have any other observers in the vehicle because of their attention and distractibility. we may recommend the student be given more hours of behind the wheel with an instructor rather than stopping at the 6 to 8 hours. We also may recommend that they have adaptive equipment in order to compensate for any physical disabilities. This is the end of the presentation. If you have any questions after viewing this presentation, please reach out to us by phone or email. We are here to help. So we have our emails here for Jenny Ream and Sarah Knowles. And then our phone number is 309-621-4107. So feel free anytime to reach out with any questions or concerns. Thank you very much.